Hey guys, it's Jennifer. Alright, so the video I'm going to be discussing today is going to be something that is being hidden in the media. It's being buried. It's not that they're not putting it out, it's just being buried. And I would say that there's kind of a good reason, but this is something that everyone needs to know. There is going to be, well, it's already going on. Certain events are occurring, and I think that they don't really know how to react, how to let people know what's actually going on, and because they don't want to cause some type of panic. And so the best way to prevent some type of panic is to be informed. So, this is kind of frightening and shocking, but the most worrisome thing that I've seen so far, because honestly, I didn't even plan on doing a video about this because I figured everybody would. I figured everybody kind of already knew about it. And I was like, everybody else is going to do one, but they're not. But the ones that I do see, I see people making it out to be some type of conspiracy or something. Trying to say, oh, there they go lying to us again. It's nothing to worry about, when unfortunately that's the furthest thing from the truth. I wish that were the fact, but this is actually going on, and we're just gonna have to see what we can do about it. Alright, so what's going on right now is there has been another Ebola breakout, or this is going to be a pandemic. And let me see, I'm going to get to this slide. I took some notes here to make sure I give you, this is the second to worst one that's ever been in history. And they honestly don't know what to do about it, because it is morphing into, let me see how I can explain it. Well, I guess kind of like the flu, to where it is. So what's going on is it is essentially like a bacterial resistant infection, to where it's not really responding the way that it should be. And not only that, it is no longer being able to be detected. That's the most frightening part. See, back in 2014, when everything happened, we kind of thought at the time, which was kind of right, but let's not get into that. At the time, it was like, okay, we'll just screen people. If they have the fever, the this, the that, then we will go further and do a blood test or whatever. And they thought at the time that they were able to find the Ebola in their blood, which they were at the time. But what they didn't realize, and this is like the most craziest thing, is that people are coming up testing negative when in fact they actually do have it. It's just laying dormant, or it's somewhere that they didn't know, which is something that's not normal. Normally, with a blood infection or something that affects your entire immune system and things like that, you're going to find it in a blood test, or a marrow test, or whatever the case may be. But in this situation, the Ebola is getting into places that they didn't even think about. Let me give you an example. There was a doctor back in 2015 that had been treating Ebola patients in Africa. And he came back to the States, thought he was totally fine, woke up a couple of months later with 2 different color eyes. He had normally blue eyes. He had one blue eye that morning and one green eye. And I'll show you right here. And so they were like, okay, what's going on here? They tested it. He had the Ebola in his eye, and it had been sitting dormant for all of those months. We also have a case where a woman infected someone else a year after her infection was supposedly cleared up. An entire year. Back in 2014, 2013 timeframe, they were only doing 21-day waiting periods, which they thought was fine. You know, if the patient recovered and they weren't showing any more signs and symptoms, then they would, you know, well, they were being quarantined, right? And they would let them go after the 21 days. Because most viruses, most things like that, bacterias, that's a good enough time frame. This is a completely different monster. And honestly, they don't know what to do. The World Health Organization has come out and said that they don't even know. They cannot even pinpoint where it's coming from. The CDC is coming out essentially saying the same thing. Let me look. I'm going to look at this article right here. This is from PBS. So, more than 1,100 people have died from Ebola. I like to call it Ebola. I'm sorry. Ebola in the Democratic Republic of the Congo, which I know this isn't important, but they are kind of contradicting where this is coming from, even in their reports, which I guess is understandable when they don't really understand where it's coming from. So today, the head of the United Nations Health Organization called an outbreak of Ebola in the Democratic Republic of the Congo one of the most complex emergencies that the WHO has ever faced. The WHO is the World Health Organization. So again, more than 1,100 people have died from the deadly virus in 2 provinces along the borders of 3 countries. That makes it the second worst Ebola outbreak ever. But as Nick Sheffin reports, experts fear that the outbreak is increasing and that the virus could soon spread. And I'm going to explain to you why that's an extremely likely possibility. Okay? Because I know people are like, okay, click off. This is Africa. Who cares? You need to care. Okay? So since January, there have been dozens of deadly attacks on clinics where beds now sit under open skies. In Geneva today, the WHO honored a murdered... Okay, that's not... But they're having attacks even on the doctors. These people don't trust the doctors and stuff like that. So they have like a civil war going on. So that's another thing that they're trying to fight while trying to treat these people. Okay? We are fighting one of the world's most dangerous viruses in one of the world's most dangerous areas. Okay, let me just get down here. Medical workers treat Ebola victims in new transparent tubes that reduce transmission risks, and they deliver a new extremely effective vaccine, but it's not working. What? It just said extremely effective vaccine, but it's not working. Okay? And health workers warn more people will die and the outbreak could spiral out of control. And these people are not the only ones that are saying it. I mean, this is alarming. So from 2013 to 2016, over 3 countries, we saw more than 11,000 people die. Are you suggesting, this is the interviewer asking the doctor, are you suggesting that there's a way that we're heading that way right now? And he replied, the great danger at the moment is the number of cases is already rising, but they're not being recorded. And the suspension of services doesn't just relate to healthcare centers. Every time you find someone with Ebola, you need to make sure that the 10, 20, 50 people that they may have come in contact with is taking the necessary precautions. So they go on to talk about a lot of things. So we're needing the U.S. to play a leading role, but they've sent like all their CDC trained people. Like, I don't know what more they can do. To a different article. This is from PBS also. The World Health Organization warned Friday that it may not be possible to contain Ebola to the 2 affected provinces in eastern Congo if violent attacks on healthcare teams continue. With the escalating violence, okay, and so this is what's going to take me into why I'm saying this needs to be on every single person's radar. Right now, we have 6,000 American troops in Africa. Okay? Let me see. And right now, it's being reported that more U.S. troops could be heading to Africa following the collapse of the ISIS caliphate. And they're not saying anything about, oh, by the way, there's Ebola in the region. And yeah, Africa's a huge continent. And there's tons of countries there. But where this outbreak is occurring is the same place, like not far from, if you remember the ambush that occurred. And I know what you're thinking. Africa's a huge continent with tons of countries. Unfortunately, these are near the ones that our soldiers are in, okay? So right now we have 20 different anti-terror operations involving nearly 6,000 troops. This is right now, and they're talking about sending more. This is extremely dangerous. He says that there are no plans for a permanent U.S. military footprint on the continent. Well, we already have one, but we do need facilities, as I say, to allow us to mitigate the whole concept of time and space, to allow our forces to get closer to the problem as it develops. This will allow us to get there quicker. The Pentagon is also warning not to expect a full-scale shift from deployments in Afghanistan to those in Africa, but they are now putting more of a focus on anti-terror operations in countries like Nigeria, Somalia, and Niger. This is insane. This is absolutely insane. And they mention nothing about, hey, by the way, there have been 32 U.S. military drone strikes in Somalia so far this year compared to 45 for all of 2018. Not only that, y'all, I know everybody's like, oh, immigration's down and this is awesome. Well, guess what, y'all? It's not down from certain countries. We're just thinking of like the ones south of our border. Yeah, they don't have Ebola down there. There have been at least 800 Congolans, whatever, people from the Congo that have immigrated here in just the 2016 or 2017, and the rest we don't have any data, so I can't say how many, but 800, that's a ton with this type of situation, this is something that spreads so fast, so easily, and so undetectable until you actually have it, and then there's like a 80% death rate. This is not a joke, y'all. This is extremely bad. So, like I was saying, it lays dormant. Well, let me see. This ASTMA, Ebola in the DRC. When one of us is at risk, we're all at risk. So this was posted 2 days ago by the American Society of Tropical Medicine and Hygiene in Arlington, Virginia. You would think they would say something. The Ebola virus outbreak in the DRC is a crisis of international magnitude in the making. At the azimuth, we see the outbreak, the second largest and the second deadliest in history, as being on the brink of a potential disaster, and yet it is nearly absent from day-to-day TV news. Without the necessary public and political will, this situation will move beyond a disaster. Azimuth is alarmed at the lack of attention and funding for this outbreak has received. And I'm telling y'all, it's because they don't know what to do. I know that makes it extremely scary, and I'm not trying to freak you out, because the worst thing to do is to freak out. You need to stay calm, and I'm going to do a video about precautions and things like that. I actually was working in the emergency room during our most recent outbreak, and so I remember, and actually the man that came to the U.S. from Dallas, well, he flew into Dallas. He was actually, they take their bodies to a crematorium and all of this, and there's only certain facilities that they can do it in, and there's only a couple of them, and the one that it was probably 45 minutes from here. So, and that's another thing. These people are dying before they're even being diagnosed. And so our soldiers, our volunteers can be out there around these dead bodies, or even people that are still alive that have no clue, and then they come back here, and then it's like they're all fine, and then a few months later they're testing positive, and so they have to go back to every single person that they came in contact with, and this is really bad. So what we need right now is full attention of governments from around the world, including the United States, to bring the solutions to the people who need it. The U.S. government has wisely developed a global health security agenda. It needs strong and sustained investment. Yeah, I mean, I don't know. This is crazy. So Azimuth is saying that they are eager to work with decision makers, government leaders, researchers, NGOs, and community health care workers in a worldwide collaborative program to end the outbreak. As leading tropical infectious disease experts, we know what is at stake. What is at stake here? We believe it's past time that we work together to bring this terrible outbreak to an end. I completely agree. I mean, this is very strange. I'm not sure if y'all remember, but about a year or two ago, there was a CDC doctor that mysteriously went missing, and then they ruled it a suicide. He had worked with Ebola and the Zika, and he was going to come public with this. He was seeing all the wheels in motion and all of these things going on, and you know the rest of the story. It wasn't a suicide. This is just out of control. It's so scary. Let me see. Ebola lingers in semen for months, studies confirm. Okay, and this article in USA Today is quite shocking too. They're saying that the regional spread of the Ebola virus after a new spike, well, geez, where did it go? Spike of cases as the World Health Organization met on whether to declare the outbreak in the Congo an international health emergency. Head of the health, I can't say his name, International Federation of Red Cross and Red Crescent Societies cited the Congolese Health Ministry statistics show 40 new cases over 2 days this week. What happened? Alright, this article from USA Today. In Geneva, a top Red Cross official said Friday he's more concerned than I've ever been about the possible regional spread of the Ebola virus after a new spike in cases as the World Health Organization met on whether to declare the outbreak in the Congo an international health emergency. Y'all, that is huge. So the head of health and care of the International Federation of Red Cross and Red Crescent Societies cited that the Congolese Health Ministry statistics showing 40 new cases this week. Holy crap. He is calling this an unprecedented in this outbreak. I think they mean an unprecedented outbreak. The Ebola outbreak in the Congo announced that it became the second deadliest in history, behind the West African one in 2014-2016 that killed more than 11,300 people. Congo's health ministry on Thursday reported that 1,200 were confirmed and probable cases, including 764 deaths. Wow. So the outbreak is occurring close to the borders of Uganda and Rwanda with South Sudan. Oh, wow. Then they have the Doctors Without Borders, and it's like they honestly don't know what to do. They don't have enough facilities, because a hospital can usually only take care of like max 10 Ebola patients at a time, and that's with very highly trained people. And so with us having troops out there, sending more troops out there is a horrific idea. It's absolutely horrific, and they're not even really putting out any travel warnings or anything like that. It's ignorant. They are so scared to let this out. I don't know if it's some kind of embarrassment that they couldn't find a cure or something, but they're going to allow it to just come to an absolute pandemic. It makes no sense to me. Absolutely not. So y'all need to like, share, and subscribe, please. Thank you so much for hanging out, and this is really serious, and I will do another video on the signs, the symptoms, the things that you can do to help prevent this, which is essentially stay away from all people. That's what's so scary. Oh my gosh, that's a scary story. But y'all, this is a big deal. This is a huge deal. Honestly, I don't know the answer. I'm like them, like there really is no answer except to like quarantine them to the country or the continent. I mean, could we even do something that silly? Especially with our military out there. I mean, I have no idea. I don't have any answers. And just like that, azimuth. Like, they're wondering, where is everybody? Why aren't we convening and getting things rolling here? It's really sad. Alright, guys. Well, again, like, share, subscribe. Please, if you can, support my channel. The links, well, I'll try to put them in the description. YouTube kind of doesn't like anything anymore. You never know what they're going to like or not like. But honestly, sharing this is the best way to do anything, okay? But y'all have a wonderful day.